Yeah, good afternoon everyone. I am Dr. Amit Prasad, a junior resident from Osmania Medical College. My guide is Dr. Modini. The title of my presentation is 1+1 free. So I'll be talking about dermoid cysts, which is one of the most common orbital tumors in children. It accounts for 46% of all the childhood orbital neoplasms and accounts up to 3 to 9% of all orbital masses. Of these, 24% are superficial, 6 to 8% are deep, and 80% of them are cystic orbital lesions. Though about majority, that is 94% of all the ocular dermoids are lateral, we often tend to see medial dermoid cysts as well. So today I'll be talking about a special case of a first and only case in the world of a twin dermoid. Mind it, it's not a deep-seated double dermoid or dumbbell-shaped dermoid, but a twin dermoid. I'm going to explain on it further. So it was a 3-year-old boy who was brought to the OPD with complaints of swelling noted near the medial canthus of the left eye, adjacent to the nasal bridge for 6 months. The swelling was painless, gradually progressive in nature, and not associated with any other complaints. No other significant history was elicited, and general and systemic examinations were within normal limits. On ocular examination, visual acuity was 6/6 in both eyes on Lee chart. On inspection, ocular symmetry was lost because of the fullness noted in the left medial canthus and also mild mechanical ptosis in the left eye. A swelling with well-defined borders measuring up to 1 into 1 centimeter was noted extending from the lid crease to the left medial canthus in close proximity to the medial orbital wall. On palpation, all the inspectory findings were confirmed, and it was a single immobile mass but with boggy consistency. The skin of the swelling was smooth and pinchable, but the posterior border could not be felt and trans-illumination was negative. So a CT orbits was done as a preoperative evaluation to rule out any bony involvement. But it showed a single round cystic lesion, but owing to its boggy consistency, trans-illumination negative, and a posterior border not being felt, we wanted to rule out a vascular involvement, so we had done a CECT orbit, which also showed a single round non-enhancing lesion. So a provisional diagnosis of a dermoid cyst was made and a plan to excise under GA. So this video, it shows that the first, initially when we started the surgery, we had removed the dermoid. It was completely excised, and just before closure, we had noticed another smooth globular structure lying right beneath it. So on further dissection and separation, we had noted that it is an entirely separate dermoid, which is a completely different origin and has no connection with the first dermoid. And this was later excised, and both these samples were sent for HPE. On histopathological examination, both the cysts showed a similar picture of a cyst lined with stratified squamous epithelium with giant cells, and cyst lumen showing lamellated layers of keratin, and cyst wall showing pilosebaceous units. This confirms the diagnosis of a dermoid cyst for both the swellings. So a case as such, like a twin dermoid with no connection between the two, is quite an exciting find, and it has never been reported ever in any international platforms. On looking back, we had noticed that both the radiologist and ophthalmologist have missed out a classic finding on the CT and the CECT. So this might be, this can be overcome by, I think, doing an extensive study, extensive investigation and careful examination of the patient in the future. And definitely these cases like this add spice to our oculoplastic journey. And this is the patient 1 month later with a very good cosmesis. Thank you. MRI was not done. We were not suspecting any intracranial extension. So, with any smooth, it clearly showed in CT as a single non-enhancing lesion. So, we were okay with that.
Ma'am, CT I think is good enough for a benign lesion, and when it's clinically excellent. Yeah, I have never seen something like this before. Yeah, it's like take one get one free.
Yes, ma'am.
Thank you so